I'm Michael Kroko, an electronics engineer. We're fortunate to have Dr. Michael Zucker here. He is a retired alternative medicine doctor who now consults on chronic disorders.
Well, chronic disease therapy is a challenge.
Understood. What chance of success do you offer for chronic disease?
Well, standard medicine is very good for acute problems, trauma, heart attacks, etc. But it falls down pretty badly on chronic problems. And with my approach and program, I say that I get over 80% major improvement. By major, I mean at least 50% reduction in the complaints. There are some exceptions, and actually the 15 or 20% that won't respond fall into generally the categories of either cancer or neuropsychiatric disease.
That's pretty impressive. Do you prescribe drugs?
I used to prescribe drugs for a few years at the beginning, and I found that for chronic disease, it didn't really produce a very good results. It might have reduced the symptoms, but there are risks and there are also side effects. So you have progression of the disease. Now, I decided to practice as an unlicensed drug-free practitioner back over 10 years ago, and I gave up prescribing drugs. And I still find that people respond very well to the program I have. And I practice under the California law, Business and Profession Code 2053.5 and 6. So it's completely legal, and I'm able to diagnose and treat.
How then do you manage asthma and allergy problems?
Well, it's a combination. Obviously, if a person comes in and has a serious allergy or asthma problem, it may be necessary to continue their medicine or to start a medicine, in which case sometimes it's necessary to have the other doctor be able to prescribe, and then I co-manage. I say that we live in the ESA, the Excited States of America. And there's just so much stimulation of the system. People are undergoing all kinds of stress, different kinds of stress, nutritional stress, chemical stress, electromagnetic stress, very common in today's electronics world. Now, if you really take a fundamental look at asthma and allergy, the commonest problem in asthma is actually just emotional stress. Now, what happens is when there's too much stimulation and emotional stress going on, you get a reaction. The body tends to defend itself. It goes into a overstimulated, contracted mode. In other words, the muscles contract, you get spasm. And there are muscles in the air tubes, the bronchi, and in asthma, these contract. And they also undergo an excessive secretion of mucus. And this is why you hear the wheezing. You also may hear coughing. Now, there are other causes of asthma. Obviously, there's allergic reactions, such as to pollen, mold, dust, animals, etc. And if you take a look at it, these kind of responses on an allergic plane, they are a kind of an angry, excessive response against something which is really not going to kill them, but somehow the body acts as if it is. In our chemical environment in the world, there's a lot of inappropriate reaction due to too much going on that challenges the system. So it's kind of like a little confusion occurs, and there's this excessive reaction. Now, there's one other kind of asthma, and that's due to cardiac failure, where there's a little bit of fluid buildup into the lungs. But we will not really deal much with that here. People tend to get into a fearful condition about the stresses of life, and they have these kinds of stress reactions. Now, what can you do about these things? Well, the first thing is to avoid the problem in the first place. In other words, try to control the stress of whatever kind. If it's emotional, you try and work out the problem over time. And if it's some sort of pollen or dust, mold, etc., One should try first to avoid it, and I have certain allergy elimination sheets that are helpful, but there also has to be the effort to decrease the overstimulation of the body. And basically, I started as a diet, and the nutrition is very important for two reasons. First of all, people tend to not have the right materials inside. They're all malnourished in order to make everything work. And second of all, they're putting in a lot of things in the diet that are inefficient and overstimulating. For instance, sweets, caffeine, alcohols, highly processed foods. And there are others. Nowadays they're putting a lot of spices and herbs into everything, which can be fairly stimulatory. So I espouse something called a quiet diet. It's in my big book, Health Truth, which I've written over the last 15 years and contains pretty much whatever I know. And the quiet diet is designed to counteract this overstimulated condition. And you might think that, well, that doesn't sound very strong, but frankly, it's stronger than drugs. And it's amazing what can be done when you let the body have a peaceful environment and you give it everything it needs to repair and have smooth operation.
What about allergy shots for pollen, mold, dust, etc.?
Well, that's been a big controversy. The standard classical approach, which is put forth by mainly the immunologists and allergists, it dealt with things like pollen, mold, etc., that we call inhalants. You inhale them and then you might react. But there are other kinds of allergy problems. Well, there's quite a lot of food allergy out there. Lots of people have food allergy. And then there's the issue of chemical allergy. Almost everybody has some sort of chemical allergy nowadays. Allergy to medication is chemical allergy, for instance. So what occurred is that the inhalants led to therapy with shots, allergy shots. And these would be given for a long period of time to gradually build up what's called blocking antibodies, things that will kind of stop you from reacting against these materials. Well, unfortunately, that doesn't work very well for foods and chemicals. And foods can cause an asthmatic response, but they usually cause other types of responses all over the body, and it can be very disabling, actually. Well, another type of therapy was worked with by other doctors with MD degrees, and it's called provocation neutralization testing and therapy. And this is very interesting. It's sort of like white magic. What you do is you, in the office, inject a little bit of a particular material, whether it's a pollen solution, or it might be a food solution, even a chemical solution. You observe for a reaction, and you increase the dose if there's no reaction. If there is a reaction, then at some point you go downwards in dose, and you go gradually down. And when you hit the right dose, magically, all the symptoms and all signs in the skin and elsewhere of response disappear. Now, how is that? That sounds very bizarre, and it is. But unlike with these allergy shots, which have to be given for a long period to gradually build up some sort of blockage, this blockage is instantaneous, and it is due to some kind of electrical interference with the reaction pathway. After all, pretty much everything is electronic. And we may not think of it that way, but the body runs on electricity and movement of ions and movement of electrons, these little particles that are going all over the place. So anyway, I started doing this provocation neutralization testing pretty aggressively when I began over 40 years ago to do holistic type of healthcare. And I saw it made tremendous improvements in people. And you give them a little vial with a solution made up with each of these materials that they react to. And by golly, you can either prevent the reaction occurring, or you can shut it down if it does occur. So it was quite useful, but it was expensive and it did require being in the office. I found over the years, however, that if I really got people to do my corrective program, that fewer and fewer people still had substantial symptoms, to the point of needing this type of approach. Now, if you do really want to have this type of in-office testing and therapy, there are organizations of doctors where they are familiar with it and can do it. The most prominent one is called the American Academy of Environmental Medicine, AAEM. And you can call them and they'll refer you to somebody in your area, pretty much all over the country.
Why has asthma become so common now?
Well, I mentioned the issue of emotional stress and stimulation. However, we live in a very chemical world now. The last 150 or so years, a lot of synthetic chemicals coming from coal tar and other derivatives. Now, these chemicals are not just play toys. They do something to make food or cosmetics more palatable or pleasant, but you pay the price. And one of the prices is that it stimulates all of the body. It's not a natural thing, and the body does know how to identify it. If you put too many of these things in, though, it starts to be hard for the body to cope with everything, and it starts to have too much response against things, and it also develops blockages in the system. We also have a heavy electromagnetic environment. That means, the cell phones, televisions, electric lights, you name it, garage door opening. You have to admit that we have a tremendous amount of exposure to various invisible rays as well as the visible ones, such as light. Now, everyone knows you have too much sun exposure, you get a burn. That's just electromagnetics right there. It's too much energy coming in. Now, a lot of people also have nutritional stress. And I tell people, if you really look carefully and do the studies, such as I did with nutritional analysis by computer, what you find is that basically nobody comes up to the government recommended figures in some area of vitamins, minerals, or food groups. That's a sad thought. But when you think about it, we have a very non-physical lifestyle. 150 years ago, people were on the farm, they ate much better food, and they did a huge amount of exercise, and they took in a lot of good quality nutrients, and they got all the vitamins, minerals, and components they needed. This is not the way it is today. So if you don't get in much food and the quality of it is not as high, you tend to not get enough vital nutrients. The body needs to either clean itself up properly and establish balance, or to make sure that it has smooth operation and repair.
How common is malnutrition?
Well, as I said, it's pretty close to 100%. Even myself, when I was younger and was doing a huge amount of racquetball play, I tested myself by computer with my actual diet for the week, and there were a few areas of vitamins or minerals that were below par, which was very surprising, because I certainly was eating a very high quality organic diet. There's another item that's important that I do called hair analysis. And this is something, again, that has been frowned on a bit by the medical establishment. However, I find it to be one of the most useful tests you can do. What it does is it tests for toxic metals such as mercury, lead, nickel, arsenic, aluminum, cadmium. And mercury, of course, is the worst of all. These things are in most everything we deal with in food supply and vaccines, as you probably know, in construction materials, in trades work. They're basically everywhere, and it's very hard to totally avoid them. But there are supplements and programs that can help get them out of the system. And I do them pretty aggressively because a lot of these tests on the hair show trouble. Hair analysis also shows minerals in the body. This is very hard to measure in other ways without huge expense. However, here you can see all of the levels, and we know pretty much what the main ones mean. And so people often have too little of very important minerals for making our enzyme systems work and the metabolism go, and our immune system and detox systems. So it's very important to get these figures and to correct them quickly. So what I use is megavitamins and minerals and a pretty careful diet, a quiet diet. The megavitamins and minerals are in a high dose because there's a lot of variation in people and what their actual needs are. So one person may need 2 milligrams of vitamin B, another might need 25. So it's better to have a little extra. Certainly for vitamin C and E, which are part of our detox mechanisms, it's important to have enough. And so what if you have expensive P? The fact is, if you take the modern drugs that doctors give, these are very, very expensive and create the most ungodly expensive pee or bowel movement that you've ever seen.
How do you feel about inhalers?
Well, inhalers are good when they're needed. And the fact is that most people who come in with asthma, they need their inhaler at least. So my way of looking at it is I don't just rip people off of medicines they need and put them onto supplements and diet, etc. I feel it's much better to get them onto the proper counterbalance of diet and supplements and other treatment. And when they are improving, which is pretty usual in the next few weeks, well, then we can reduce the dose of the medicines that they're taking. And I found that under my program, people generally ended up on half or less of the medicine they started on, and many ended up on no drugs at all. I think that's a pretty good response. Now, as far as inhalers go, the over-the-counter ones that we started with, the Primatene Mist, etc., they were good, but they were problematic because they caused too much stimulation of the heart and nervous system. So they developed newer brands of inhalants based on something called albuterol. And these work quite well without that stimulation in the body. Then there's steroid inhalers. Now, those can be very useful too. They're stronger anti-inflammatory inhalers. They stop some of this twitching in the lungs. However, steroids do have a side effect of weakening the immunity and tissues in an area. So there is some chance that one might have more easy infection in the lung area if you use them a lot. Steroids taken by mouth are much, much stronger, and they are very valuable when a person comes in with severe asthma, which is life-threatening. Large doses are given, and fairly quickly it knocks down the reaction. So those are good in the right circumstance. Again, you have to consider risk versus benefit. So if I can get in there quickly with my program, generally the risk is considerably reduced, and then we can lower doses of medicine as we go along.
Do you treat chemical allergy?
Well, as I mentioned, chemical allergy is actually quite common. It's just not called that very much. As a matter of fact, the allergists didn't really want to admit that food and chemical reactions were an allergic problem because they didn't have the right kind of molecule inside reacting. But we have found since then that there are similar molecules of immune activity that are going on with either food or chemical sensitivity. So this is a frequent problem, but the chemical issue is difficult to contend with. So that's the downside. What is the upside? The upside is when people have gotten badly intoxicated with chemicals, on this program that I have got outlined, they actually gradually improve if they keep avoiding the chemical exposure. They gradually get rid of these things from the body, and their symptoms gradually die down and die down. And I would say this is in 100% of the cases. Do they go away entirely? Generally, no, if it's a severe problem. But they can get down to a low enough level that they're really not any problem in life. So that's what I consider a very major improvement. there are other things in the way of supplements that can be used for detoxification. And my favorite one is kyolic garlic, an amazing herb for the modern world. And I took it for 15 years every day. And by God, I got rid of almost all the mercury that was in my system, which was quite a bit at that time, with all my silver fillings, et cetera, et cetera. So these supplements can be really important in a detox program. And when you're treating people with allergy, you really have to also work with reducing the chemical load in the system. That's detoxification.
That's quite interesting and very encouraging. Thank you for your insights.
Well, you're welcome. All deserve a chance to get well.